Hi, I'm Dr. Leslie McElrath of Monarch Ideal Care, and one of the things that is very important to me is that all of my patients actually enjoy coming to the doctor. Or, okay, at least if they don't enjoy it, they don't fear it, right? Going to the doctor should not be a scary thing. It should be an opportunity for you to learn more about yourself, about your body, about how things work. That's what going to the doctor should be. And coming to my practice, like I have patients that on more than one occasion, they see the lights on in the office, they come in and check out to see if I'm there, and all of a sudden they're sitting on my couch and we're sitting around chit-chatting for 4 hours. Like, that's the type of relationship that I have with my patients. And the reason that I have that relationship with my patients is because they know that I'm there for them when they need me. I want them to learn about their health. I want to teach them about their health. I want to keep them out of my office. Honestly, I really do. But they love being there because I give them a sense of understanding, of wonder. I've had many a patient where I'm going through their labs, explaining everything to them, and they're like, nobody's ever explained that to me. And I'm like, so then how do you know that you're healthy? If you don't understand what these numbers, oh, they just tell you, well, you're fine. But like many a person has been dropped on the line of you're fine when they know they're not. I learned when I was in training, one of my seniors said to me, we treat people, not numbers. And I remind my patients of that all the time. Like, just because the numbers say you're okay, if you're not okay, then we have to figure out why you still don't feel okay. And because I take that attitude with my patients, they're excited to try new things. They're excited to learn new things. They know that I trust them when they say, hey, something's wrong. And I trust them because they trust me back. I don't ever fear. I'm sure you've seen this on like TV shows where the doctor doesn't believe that the patient isn't taking their medicine. And that's something that like even I have felt that way, especially back in training days. But with the relationship that I build with my patients now, like if my patient says that they're taking their meds, I trust that they're taking their meds because they know that they don't have to lie to me. Because the only person that you hurt when you lie to your doctor is you. Because my recommendations are only as good as the information that I have. My patients understand that. And they come to me with questions and, hey, can you check out this article to see if this medication will work for me? And I wanted to do this. What do you think? Like my patients come to me constantly with like, hey, this is what's going on out in the world. Can you look into this with me so that we can figure out what's going to work best for me? And I love that. I love that sense of wonder that my patients have. I encourage that because that creates autonomy. That creates a sense that my body is my responsibility. I can't pass that off to somebody else. And I fear that that's a thing that we have encouraged in healthcare, that it's your doctor's responsibility to make you healthy. It's not. Like, I can barely control myself. How can I control you when you're not living in my house? But I can teach you the things to look for. I can tell you at what point do you reach out to me, and I can create an atmosphere where you know that if you do reach out to me, even if it's nothing, I'm going to take it seriously. One of the things that we sometimes forget as physicians is things that are mundane to us because we see it every day feel like life and death to a patient. You have to take that into account when you're talking to people. And so I try to remind myself of that all the time. Like, hey, this thing that's just like, oh, that's just a medication side effect. Like, this person thought they were dying. I have to take that information and give them, hey, no, you're not dying. This is how I would know if you were dying. You're not dying. You also have to have the discernment to know when not to tell people that, because like hypochondriacs, yeah, I'm a hypochondriac. You don't tell me those things. But for most people, it's about creating that sense of wonder. It's about creating that sense of, I can go and talk to my doctor, I can do research, and she's not going to be mad at me for doing my own research into my own health. Like, that makes no sense to me when I've had patients tell me that like, the doctor was mad because I looked into this on my own. Why? You just did half of the research for me. Like, even if your research was wrong, it's my job to tell you why that situation does not fit your situation. And I take that job seriously. I love doing that for my patients. And so at Monarch Ideal Care, it's not just about here's another pill. It's about, hey, if you're willing to make lifestyle changes, let's talk about that. Let's talk about what that looks like. If you're willing to change your diet, but we need a little medication boost, okay, let's do that while we're working on these things. Like, it's about meeting you where you are as opposed to where I want you to be. And so with that, working with a doctor like me, if you're in the Akron, Farallon area, working with a doctor like me is like working with your best friend that just happens to know medicine and can prescribe things if you need it to be. Like, I want my patients to have that sense that this person actually genuinely cares. Because I do.